We're going to change dentistry together. I'm really excited to talk to you about the topic today. And basically, what I'm trying to address is how would you want to treat your family's teeth? You know, when our kids come in and we take the checkup radiographs, we're hoping we don't see any improper because it starts out small, and if it gets big enough and we have to fill it, and then that filling may fail and we might get some recurrent decay, so we have to fill it again, and that filling gets bigger and bigger and bigger. And maybe when they're in their 40s, that filling now necessitates more coverage, such as a crown. Maybe 10 years after that, that crown needs a root canal. And maybe our child, at that point, a fairly old adult, probably 50 or 60, bites on something hard and that tooth snaps off. Or maybe it needs a root canal. So we see that over and over in our daily practice, from small to big, and then even worse. So what we're going to talk about today is how can we use today's technology and today's materials to actually prevent that sort of tooth life cycle to occur. So my feeling is that dentistry is moving from a reactive model to one that is more proactive. And our patients today are always on the phone and they're always checking everything out and they're Dr. Google. So they are aware of what's possible. We're giving patients more control over their health with a fast, affordable, visual experience that helps them truly understand what's going on in the mouth. You know, one of the hard things is the patient comes in for their cleaning appointment and we tell them, oh, you have plaque here, or have you been flossing because your gums are bleeding there? But it's really hard for them to understand. And we give them a mirror and we try to show them the plaque. We wipe it off and we show that plaque to them in front of their eyes. I don't think it really resonates with the patients, what the ramifications of that white, sticky, pasty thing is on their teeth. Well, today we can give them a visual experience to help them understand what's going on and where that biofilm is in their mouth. And then if we see that and we can't control it with brushing and flossing, then what we can do is we can apply today medicaments with delivery trays that hold the medicaments around the teeth, push the medicaments underneath the gums and the sulcus. And with these medicaments today, we can control biofilm and the effects of biofilm. And that's what I hope to show you today. And that's the exciting part. If we can show them where the biofilm is and we can control it, we give back control to our patients. So on the far left-hand side, what you see an intraoral image taken with this intraoral camera. It's called the Q-ray pen. And with that, we get an intraoral image. And I know I was just lecturing this last weekend, and I asked the group of doctors, how many of you have intraoral cameras? And probably about 70 to 80% of them raise their hands. So I get it. We have these images. But when we have these images, what do? We show the patients the plaque around this implant. And I'm showing an implant. It could be a tooth, but in the oral cavity, there's an area where this plaque, and then as it matures, becomes biofilm, exists in the mouth. And when we show them this and we tell them, you got to clean in this area, I don't know how well that resonates with them. But with this intraoral camera now, we get the white light image and we get a biofluorescent image. And what we tell the patients before we show them this image is that if you see red, the red means there's bacteria there, and that is a bad thing. So on the right side image, look at all the red that we have there. And now if the patient understands this and they know that red is bad, they'll start to ask you, what do I do? And I think that is where we can motivate our patients better. They're making an educated visual observation. Then what we do is we use these PerioProtect trays to deliver gel medicaments against the teeth and below the gum line. It's not something that we rinse with that's gone. It's not something we have to brush off that then they go out and eat or drink something and it's gone. So we're using this biofluorescence technology to make that biofilm red. And the way it works is through whichever device we're using, there's a blue light. A 405 nanometer blue light is emitted. Then through proprietary lenses, what we see and what our patients can see appears red. So basically we just tell the patients, red is bad. If you see red, we want to clean that red off because in those areas you're going to get disease. Now, if the red is at the gum line, we're going to get gingivitis, periodontitis. Your bones are going to be in, or your gum. And just systemically, that's not a good thing because you're going to have a systemic reaction to that chronic localized infection. Then if it's around an implant, you're going to get perimucositis or periimplantitis, which means you run the risk of losing that implant. And you went through a lot to get that implant, and you probably paid a pretty penny for that implant. So let's work to keep that healthier. So where you see that red, we're going to look at the red today. You're going to keep that area clean, and then we're going to check it when you come back. And if it's still red, then what we're going to do is we're going to recommend that you use PerioTrays. Now what the PerioTrays do is they are custom made, and they fit tightly around the neck of a tooth or around the cervical area of an implant. And when we put these medicaments in there, one, the medicaments can be held against the tooth, and then it's going to get pushed down into that sulcus. And what the Perigel, which is a 1.7% hydrogen peroxide gel, is going to do is layer by layer, like peeling back an onion, it's going to begin to break down the biofilm. So the red glow that the patients see is because of biofilm. And now we're going to use a medicament, Perigel, and PerioTrays to remove that biofilm. So it all ties together. The Q-ray pen is helping us show the patients where that biofilm is and increasing the value to them of using the PerioProtect trays. So again, you can see the white light image and the red light image, and just imagine how much more motivated the patient. All right. So let me ask you about this case. This is your white light image, and it's a molar. I think it's a lower right first molar, and on that molar it's a PFM with some black scuzz over the top, occlusal surface, the bind surface, and then along the root we have a lot of plaque. Well, the white light image, we show the patient, see all this white material down here? We don't want that. That white material, that is bacteria, and it can cause root decay, a cavity in the root, or that bacteria can cause a cavity underneath the crown. Both are bad. But when we tell the patient red is bad, here's the biofluorescent intraoral image, now it glows, and now they can see how bad that is. And then what we can do is we can clean all that off, do our prophy appointment, clean all that off, and show them the image again where it won't glow red because we have removed that biofilm. But this image helps them to understand that their daily oral hygiene regimen probably is not up to par. And at some point, we're all going to pay for that. So this red color resonates with the patients. Instead of that white light image, where it's very difficult to see that plaque, now they can see that red glow. So again, you go from that white light image, doesn't look that bad. To us it does. But put yourself in the shoes of a patient. Do they really understand what that image is showing them? So here's a PerioProtect reimage. We talked about using the Perigel, which is a 1.7% hydrogen peroxide, to treat the gums. But on the example like we just saw, to prevent decay in that root area, on patients that are high risk, have dry mouth, or even chronic sensitivity, one of the adjuncts that we see that works really well, especially in that PerioTray, is this Remin gel. So the Remin gel placed in the PerioTrays is held against the teeth, and so it's going to help remineralize those areas. We know that that acid is breaking down the tooth structure. What we do is we remineralize it with the Remin gel. The Remin gel is a great desensitizer, and it helps to heal the tooth. So what Remin gel has is it has calcium, phosphates, potassium for the sensitivity, the monatite and the brushite, which are precursors to hydroxyapatite and hydroxyapatite. It's all in the Remin gel. And so depending on the pH of the patient's mouth, that will alter which precursors are present. Any way that you put this, we're going to get better remineralization of the tooth, and better occlusion of the dental tubules where the patient's having sensitivity. So what you see here is a control, and what you're looking at is red are like higher peaks where there's more tooth structure, blue is where there's valleys, where there's been damage to the tooth. So what they did is they demineralized a tooth sample for 7 days. And what you can see is there's not a lot of red, but there's a lot of blue because that acid has taken away some of that tooth structure. Now that same sample is put into Remin gel for 11 treatments. And over the 11 treatments, you can see how the Remin gel has helped to form more tooth structure, more hydroxyapatite. And that is motivating. It's nice to see that. On the left-hand side, you see open dental tubules. And so what Remin gel has, it has the potassium ions to get into those tubules to depolarize the nerve and make the patient more comfortable. But over time, using this Remin gel, you can see that we get complete occlusion of the tubules because we have all the precursors of hydroxyapatite and hydroxyapatite. So that gets into those tubules and we just begin to occlude the tubules and the sensitivity goes away very, very quickly. So if we're trying to use the perio trays for remineralization, on the RX we just write make upper and lower Remin trays, and they're going to make these trays and send us some Remin gel with the trays. Now we're set to go. Let me share a story. Had a patient with a lot of sensitivity, and we've had a few of these patients, but one comes to mind. Patient has really bad sensitivity. Patient is convinced they need a root canal just because the sensitivity has been increasing, and hurts. They feel a lot of discomfort. So I discuss this with the patient, and we check the bite, we check hygiene, keep that area really clean. Patient is using a prescription strength fluoride gel at night, brushing it on. Sensitivity is still increasing. Patient is again convinced we have to do a root canal. I'm not ready to do a root canal yet. So I take the Remin gel and ask the patient, take your perio trays, use the Remin gel. Just what you see on the right hand side is you just cut the tip off of the tube, put a little ribbon of the gel in the tray, place the tray, wear it for 15 minutes. At the end of 15 minutes, remove the tray. You can rinse your mouth out or leave the gel there depending if it's bothering you or not. But inside your tray, you just gently take a toothbrush and remove the gel. Patient, if we say scale of 100 to 0, where 100 is a lot of discomfort and 0 is back to comfort, if I asked the patient that day if they just even breathed in or drank a cold fluid, how they felt, they were definitely at 100, 100 being maximum discomfort. Well, patient tried this Remin gel, and the next day the patient reported it went from 100 probably down to about 2 or 3. So in one use of the Remin gel in the perio tray, almost all the sensitivity was gone. Next day, another 50 minutes with the Remin gel, and now the sensitivity was totally gone. Nothing was bothering the patient at that point. To me, that's powerful medicine. You know, when you can take patients that have sensitivity, you're using something that's fluoride free, they use it for 2 days, and all that sensitivity that felt like they needed a root canal is gone. I think that's good medicine. And then if you want to use your perio trays to control both the soft tissue bone health and the tooth health with the Remin gel, then you send your scans in and you ask PerioProtect to make you an upper and lower PerioProtect tray and then add in the Remin. So what they'll do is they'll make the trays for you. They'll send you 3 tubes of the perio gel and 1 tube of the Remin gel. Again, very effective therapy for our patients. So let's go back to what I was talking about at the beginning of this. How would you want to treat your patients? What we're able to do when we can show the patients the biofluorescent image is we can show them where problems could occur before they do. So what we do is if we show them the red and we help them control the red and we do it successfully, they're not going to have gum disease. They're not going to have a lot of decay. But if we show them the red and they're having a hard time controlling that, Then we're going to use very minimally invasive therapies. The PerioProtect tray with the PerioGel to control the inflammation of the gums. And then we're going to use the PerioTrays with the Remin gel to help remineralize the teeth. So, an exciting part in dentistry is that we're going from reactive, we wait until we see a lesion, then we treat it, usually with at least a filling, to, okay, we're starting to see some early decalcification, maybe some white spot lesions. Let's treat that with the Remin gel. So we can be very conservative, and if we can do that for our family members, we can have early detection before there's a big problem and treat it very conservatively. I think that's the best that dentistry can deliver to our patients today. If we see the gum disease, which we know there's an oral systemic connection between the gum disease, the biofilm, and the inflammation, and we can treat that with the PerioProtect trays with the PerioGel, then again, I think we're offering our patients the very best we can. So I hope you like this information. I hope you can apply this information. I hope you find it interesting. I hope you see this as a great way to treat your patients in a very conservative way, empowering them with the visual aids that we have today. If you like this information, please hit subscribe. We'd love you to become a subscriber, and hit the like button too if you like this information. Again, we're trying to form a community of like-minded individuals trying to do the very best for their patients. And I think today's material that we discussed really exemplifies the best we can do. All right. Well, thank you very much, and I'll see you next week.